Hi, everybody, and welcome to Autism Awakening. This is an extremely special podcast because I am ecstatic to have as my guest Temple Grandin. I saw her last month at the TACA conference in 2023. I had seen her before at multiple conferences, the Autism Asperger's conference in Las Vegas. I think 2019 we were together. So I'm super honored to have you here. And I'm glad that we're going to be talking about early education and some really tangible things that we can do and families can do to help their kids.
Hey, great. Well, I had no speech until I was 4 years old. All of the really severe symptoms of autism. And the first thing I want to say, if you have a 2-year-old or a 3-year-old that's not talking, you've got to do something about it. Do not wait. Unfortunately, there's some parts of the country where there's no services, other parts of the country where there's really good services. But you don't want to wait a year to start working on a little child. He's not talking. Okay, rule out deafness and rule out tongue-tied or something like that. Once you've ruled that out, get working with them. Because the worst thing you can do with little kids that are not talking is to just let them zone out on electronics. That's what you don't do. And what was done in I just want to explain what was done in my early intervention program. It started at 2.5, nonverbal, real severe symptoms, no signs of epilepsy. That's usually a good sign. So there were 4 things that were basically done in my program. And the first was working on speech. And you always want to encourage the child to use their words. Now, my speech teacher would hold up a cup like this, and she'd say cup, and then she'd also say cuppa, because if you talk too fast, it went to gibberish. Slow down when you talk to these kids. Also, give them time to respond. They're like a phone with poor service. It takes time for it to download a web page. Give it time to respond. And then always ask them to request things with their words. Now, if you have a child that doesn't very quickly get speech, you've got to give them some other way to communicate. Sign language, picture board, communication device. They've got to have something to communicate with. So the second goal in my early education program was turn taking at all kinds of games. And this teaches how to wait, really important. How to inhibit a response and how to wait. My speech teacher put a lot of emphasis on that. So let's say the child's lining up blocks, we take turns lining up the blocks. All kinds of little turn-taking games. Then later on, when I was 6 and 7 years old, lots of board games. Learning how to wait and take turns, not be a sore loser. Then the third thing in my little kids program was skills. Toothbrushing, dressing, putting on clothes, using utensils to eat with, basic skills. Now, I want to get progress in those 3 things. And the child should like going to therapy. The child hates therapy, then the child's getting forced into sensory overload. They should enjoy going to therapy. Now, you'll notice no emphasis on eye contact. And this is something that some of the advocates really objected to. The problem with forcing eye contact is it loads that slow processor. It's going to be harder for the kid to think of his words. I don't think eye contact would come later. I wouldn't worry about that 2-year-old. So it's words, using language, turn taking at games, and basic skills. You know, not eating mashed potatoes with your hands, for example. So teaching them how to eat, teach them how to put the coat on, the skills. And later on, they've got a lot more things to learn, but that's my take on a little kids program, and that was very effective for me.
That's great. And you know, I love what you mentioned about the eye contact. It's I always associated that in my office as a sensory symptom. It's just
Yes.
too much input, whether it's the hearing or
that's the thing.
Yeah.
It's too much input. You're loading a processor. If I was a computer, I'd be an Intel 286 with warehouses full of memory, with servers for memory. But you got to run it all through a little bitty processor. And if you load that little bitty processor, you're going to have problems. So let's just say something about sensory. I didn't like balloons popping. Now, they didn't know how to deal with this. What should have been done is let me blow up a balloon just really small, and then I pop it. And I can go make them bigger gradually where I pop it. In other words, give me control of the sound. Because I've talked to several families where their kid was terrified of a vacuum cleaner. and they let the child turn it on and off and play with it. When the kid got to control the noise of that vacuum cleaner, it went from a scary thing to a fun thing to play with. This whole element of control is very important on noise sensitivity. The other thing is, if a child wears headphones all the time, they are going to get worse on the sound sensitivity. It will worsen. Okay, what they can do is have them with them. And then that's control. You try not to wear them. There's a few really awful places, maybe train station, subway, New York subway, put them on then. Or maybe these bathrooms where you have all these hand dryers and flushers going off randomly. Yeah, you wear it in there. Some of the really bad places like that. And then the rest of the time, have it off. But you can have it with you. That gives you control. This is something that's really important on the sensory. Because even with my squeezing machine, it enabled me to tolerate being hugged because I controlled the squeeze machine. That's really, really, really important on some of the sensory stuff.
Yeah, and I think it comes down, and I want to hear, from you. It comes down for the kids just being overwhelmed with fear and anxiety. And if you have control of those things, like some parents will say they can handle certain noises, but not the other ones. And I say those are the unexpected ones. Those are the sudden adrenaline boosters.
Well, then what do we do about dogs barking or babies crying? Because I can't control that. Well, you could get a high quality audio recording. It needs to be high quality of dogs barking and babies crying, and then let the child play it really softly, giving them some control, and maybe doing a 15 minutes a day of that, where they can control it. And that would have to be done with an audio recording.
Those are fantastic ideas. And again, it's these basics, that parents are dealing with on a day-to-day, hour-to-hour, minute-to-minute basis of how the child's feeling and how that behavior from the child affects the family dynamics.
Well, then the other thing, in the 50s, social skills were taught in a much more structured manner. And they used a method that I call teachable moments. So let's just say, I got my drink here, and I stirred it like this. Instead of screaming no, Mother would say, use the spoon. You give the instruction instead of screaming no. And now, obviously, they're running out in the street. You got to just grab them. But these kind of mistakes made at the dinner table. Let's say they're touching too much stuff at a store. You would say, only touch the things you're going to buy. You give the instruction instead of screaming no.
And that goes back to giving control.
Yeah. And that was a standard method in the 50s, because I'm seeing a lot of grandmothers that come up to me. They discover they're autistic when the kids get diagnosed. Mm-hmm. And they had good jobs. And one of the reasons, there's two reasons. They were taught basic social skills. They were taught those. And they had paper routes, and they learned job skills before they graduated from high school. And we need to find substitutes for those paper routes. Chores for kids in the house. But around 11, they need to start doing something on a schedule outside the home, walking the next door neighbor's dog, a church volunteer job, maybe reading to old folks in the nursing home, something you can just set up in the neighborhood that they can do on a schedule outside the home. Because where we're really falling down is making the jump into the workplace. And working skills are very different than academic skills.
No, that is great. You and I were talking about this at the TACA conference, and I think it's just not happening in our society now in general. And
I think it hurts the autistic kids more than it hurts the normal kids. Now, this is my book, The Way I See It. Okay, a lot of mine say, "Oh, who wants to read a big fat book?" Well, it's a whole lot of little short chapters. You can skip around it. And then I have another version of this for new parents. It's called Guide to Education. It's a little tiny, small book. Well, you can read it really quickly. It packs a lot of stuff in there. It's called something Education, The Way I See It. It's a little small gray and white black book, and you can read that quickly. A lot of people want quicker sources of information. It's got good reviews on Amazon. Came out last year. So we've kind of talked about the little kid phase. Mm-hmm. Now, another big problem is bullying. And I managed to get through elementary school without being bullied, because Mrs. Deach explained to the other students when I was not there that had a disability that was not visible, like a wheelchair. And they needed to be helping me, not torturing me. And that's called peer-mediated intervention. It actually has a name. Now, you might get into HIPAA problems with that, but that worked. And I went to a small elementary school, 12, 13 kids in the class. Everybody got invited to everybody's birthday parties. In the 50s, all the kids were using tools. We made stuff. So I'd do projects with other kids. That'd be friends who shared interests. Adolescence was a disaster. Big school did not work. I got kicked out for fighting after a girl teased me and throwing a book. Complete disaster. Well, you see, girls weren't interested in doing projects anymore. But where I had friends was friends who shared interest, riding horses. That was a big shared interest. For another kid, I've had a couple of moms tell me, oh, my kid's at the local high school and he's in band and loving it. That's been, now it wouldn't work for me because I never could figure out how to play musical instruments. But these kids, that was wonderful that they were in band. You know, this is friends who shared interests. I have a paper called How Horses Help the Teenager with Autism Make Friends and Learn How to Work. And references to peer-mediated intervention are in that paper. And it's a relatively recent paper.
That's great. You've written a lot. I mean, I just got your book, Visual Thinkers.
Oh, yeah, right here. Visual thinking. And
Yep.
this is the other thing, developing strengths. And I'm an object visualizer. Everything I think about is a picture. It's a photograph. Right now it's snowing outside and I'm going, I better get to the grocery store before the car is snowed in. I'll probably be going right after this interview. I thought the snow had stopped, but I don't know, a couple of inches already built up, and I definitely got to go grocery shopping before I go on a trip tomorrow. You see, but I'm seeing it. I'm thinking, yeah, I've got to get this done, and I've got some stuff I just got to get. That's seeing it. Then you have the spatial visualizer. This is your mathematician. Patterns. I think in photographs. The HBO movie Temple Grandin shows exactly how I think. And other kids might be mathematicians, patterns. And then you have the kid who loves history. They're the word thinkers. They're extreme word thinkers. And again, ask, well, how do I tell what kind of thinker a kid is? Well, I can't tell in a 3-year-old usually. But they get a little bit older, the art ability will come out. If they're given access to materials to make things, the visual thinkers and the math kids make things. The math kid needs to be moved ahead in math. Don't make them do baby, boring math. I was exposed to musical instruments. I never could figure out how to play them. But another kid will take off with that. And music and math go together. These two things, music and math, go together. In fact, in that movie about Oppenheimer, they talked about kind of understanding algebra like a musical score. Well, I don't get that. And picture thinker. Get kids exposed to a lot of stuff. Build up on something they're good at. And if they're good, let's say you have an interest like cars, for example. Well, you could teach reading with a car. You could do some mathematics involving cars. You can learn how to fix them. So let's talk about the kinds of jobs that different thinkers would be good at. My kind of mind, mechanical stuff. I've done a lot of cattle handling facilities, steel and concrete, formed concrete work, steel fencing, center track restrainer system that's in every one of the big packing plants. You eat a steak, it's a good chance it went through my system. I'm pretty good for somebody who can't do algebra. And there's a whole part of engineering. I call them the clever engineers. They're usually high school graduates, took shop class in high school, and they can build anything. And they make like packaging equipment. Then you have a degreed engineer. They're going to make sure the building doesn't fall down and the boilers work and the refrigeration system works to keep the food from going bad. That's a mathematician's job. So that's different kinds of minds working together. You see, a degreed engineer is much more of a mathematician, and the clever engineers in the shop often don't get enough credit. I had an engineer with a degree go, they just do manufacturing. I was on a ride to the airport. I was not pleased about this. And I said they do a lot more than that. I worked with 2 people that own big shops, and they have 10 to 20 patents each. They've invented a lot of equipment and they're selling it around the world. And I have to be vague about it because they're not publicly disclosed. So I have to be vague about what they build. But a lot of these people are doing a lot more than just manufacturing. And I'm worried that these people are getting screened out. And we're going to need people to fix elevators. We're going to need people to fix cars. And one of the places where the video game addicts can sometimes be weaned off the video games is fixing cars. That's been successful in 5 or 6 cases. And I talked to one adult and he said motors were a lot more interesting. And the other thing about the hands-on jobs, AI will not remove these jobs, period. And jobs like a nurse, that's never going to go away. You know, I can see some medical specialists getting taken over by AI, but basic frontline doctors, no. You've got to have the people working on the front lines in the hospital. That's not going to go away. Robots aren't doing that any foreseeable future. But I can see video game design going all AI. I just read an article in the New Yorker magazine about a programmer, and he was just stunned at what ChatGPT could do. But he also said that it was like working with a beginner student. You have to prompt it. So there's still going to be a place for very high level programming. But programming like, okay, how to get the tables to be the right format on a paper. Oh, ChatGPT aced that one. And he was kind of upset about that because he said, I wrote some beautiful code for that. So I can see a lot of, right now, these AI programs are discovering antibiotics. They are discovering new alloys and materials and metals. I'm following this very, very closely. I'm following the industry very closely. They're not going to fix cars anytime soon. Elevators need to be fixed. They're not getting fixed right now. And they're not going away either. And they're going to be mechanical unless we get anti-gravity. Well, that's not happening anytime soon. So hands-on jobs are safe. You know, people tend to kind of stick their nose up at the skilled trades, but these jobs are safe from AI. Electricians not going to get replaced. Plumbers, fixing cars, and just designing mechanical things.
It's
then you have your word thinker. Okay, some people say I neglect. There's an autistic that's a word thinker, and most so-called normal people, they're mixtures of the different kinds of thinking. And in my book, Visual Thinking, I provide all the science behind the different kinds of thinking. And an autistic person might be an extreme object visualizer or an extreme math person. And then you also get this extreme word person. This is the autistic that loves history. They love facts. They'll know everything about baseball teams or some other thing, or movie stars. Now, where these people can really shine in the workplace is what I have a special category of jobs I made up. Quiet, specialized retail, where you're recognized for your knowledge of a product. And these are places where autistic people have had great success in jobs, selling new cars. That's been very successful, probably 5 or 6 cases of that. Selling sporting goods. You're recognized for your knowledge of all the different baseball gloves or hockey sticks or whatever. Selling business insurance. Banks have hired them to sell financial products I don't even understand. But these are places, but it's all in a quiet environment, and you're dealing with one client at a time. And most of these places are fairly quiet. Selling phones would be another one. And people like the idea that, you don't have some salesman just shoving the most expensive car down your throat or the most expensive phone down your throat, but helping you to pick out the right phone for you, not the most expensive phone, but the right phone for your budget. And people appreciate that. And that can be a great job for people on the history lovers. And those are jobs that have been successful. In fact, the sporting goods guys now manages a sporting goods store. And sometimes that's dicey. Then they're getting into social stuff that maybe they should have stayed out of. But those are just some of the things on jobs. Okay, maybe you've got a question.
No, this is great. And I know that this is so inspiring to families who, feel frustrated and feel alone. They're on an island because they've got a child who might be, partially verbal or nonverbal. And to hear that, hey, you know what, 15 years from now, that their child's going to be able to be independent. and be able to
Well,
take.
it depends. That the ones that are fully verbal, yes, they should be able to get to be independent. But then you've got some that are partially verbal. They have more challenges. Now, some of your non-speaking can learn to type totally independently. They almost have a locked-in syndrome. And I think typing on a tablet needs to be introduced quickly. If the kid's not talking, let's introduce typing on a tablet. And I talk to a lot of low-income folks, so I tend to give the things that anybody can do. Old tablets are free. They can be found. There's only two things that have to work on it, either Microsoft Word or the text messaging function. You don't send the texts. All you do is you type them, and then you back out of them for the other person to type something. And you can find old tablets. Don't tell me, even in the lowest income place, an old tablet where maybe one of those functions will work. And there's a reason for a tablet. On this desktop, this keyboard's way down here. And then when the print appears, it's way up here. So for a desktop, you'd have to put the keyboard on a box. The print needs to appear right next to the keyboard. So there's no attention shift between the keyboard and the writing. That's really important. And that's why I'm pushing the tablet. Phones tend to be too little. There are some that have learned to type on a phone, but they're little. Let's just start with the tablet. There's also, devices you can buy that's basically a keyboard with a little screen right next to the keyboard. You could do that. And there's some good books written by people who are totally non-speaking. There's Tito Mukapadahe. I don't know how to spell Mukapadahe. How Can I Talk If My Lips Don't Move? These are all available on Amazon. How Can I Talk If My Lips Don't Move? There's Carly's Voice. That's Carly with a C as in Charlie. And then there's the Japanese boy, The Reason I Jump. But there's a sequel to The Reason I Jump that's a much better book because he's older and he has more insight. And he talks about being like a broken robot. He couldn't control his motions. He talks about that his carers, that's what he called people, were going to help him too much. He wanted to learn how to put the jacket on. But those are very, very good books. And they're readily available. And if you have an individual that's over age 7 that's non-speaking, I think all 4 of those books you should buy. And those are people verified to type independently. Nobody is touching them. And when I met Tito, he come in this library. We were in a library, and he come in, he flapped, and he grabbed a yellow magazine and was flapping it. And his mom yanked him over the table, and he had a little keyboard thing where the print appears right next to the keyboard. And his mom says, well, he wants to talk about autism. I said, no, we're not talking about autism. We're going to talk about something I find in one of these old Scientific Americans that are in a pile here. So I pulled a Scientific American out of the bottom of the pile. I don't even, an old Scientific American. And I found this weird picture. It's an ad for a tech company, and it showed an astronaut in a spacesuit riding a horse in the desert. That's what the picture showed. And so I put it in front of Tito and I said, tell me about this picture. And he typed super fast, Apollo 11 on a horse. There's no way that could have been cute. It was so quick. And none of us had seen that picture until I opened the magazine. That's why I chose it. And another thing that Tito tends to do is go in the back door on naming things. Like you show him a picture of a rose, he might say the colored part of a plant's called the flower or something like that. Goes in the back door. He didn't say astronaut on a horse in the desert. He said Apollo 11 on the horse on the desert. But these are people that can type completely independently. And that needs to be, you may have to give them some support to start with, but you've got to get your hands off of them in order to verify that it's their typing. And then you get the clever hands effect. Well, this was too quick for clever hands. Somebody that's the horse that was getting cues from the trainer on counting, and he'd tap his foot. But this was too quick for that. I'm fully aware of clever hands. And that's why, and then one time I asked Tito what it was like before he had typing, and he said, emptiness. It's what he said, emptiness. So I'm a big proponent with non-speaking to start typing on a tablet right away. And there's other fancier things that you can use, but you know, then they've got to have a way to communicate. I want to get away from these cardboard letterboard things because I can't follow those. I'd rather be typing on something where the print appears, where the person you're talking to can read that.
Yeah, and you've got control over that. Now, you brought up something that I wanted to ask you. I mean, it's so sad about Tito when he said without his typing, he was empty.
That's
And
what he said. That's what he said. One word, empty. In fact, we were at a conference, and it was a conference in Canada, and Tito, they didn't have Zoom then, they had some other kind of video link. And Tito comes in on a video link because he couldn't go to the conference. And I asked him that question, and he typed one word, and it appeared on the screen as he typed. Emptiness. That's what it was before he had typing, before he had words.
I know so many parents want to kind of just open up their child's mind and understand what's going on inside. Can you enlighten parents?
Well, the typing would do it if you have a child that doesn't speak. Now, then some of these have normal intelligence. And then you might have others where the brain's so full of epilepsy, and you got a lot of epileptic stuff in the brain that doesn't help the prognosis any. Then let's say with a non-speaking individual, they have a meltdown and this kind of problem. Now, the first thing in troubleshooting that, you have to rule out a hidden painful medical problem they cannot tell you about. And stomach aches are big number one. Acid reflux, big number one. The urinary tract infection, a toothache, an earache, stuff they can't tell you about, a yeast infection, constipation. These are things they can't tell you about. And then, is it happening in a chaotic, noisy environment? That'd be sensory overload. Yeah, you got to. And then sometimes they pitch a fit to manipulate. That sometimes happens. That's strictly behavior. But you've got to rule out the hidden painful medical. That's big number one. And just sensory overload in the middle of a busy Walmart would be sensory overload. You've got to figure out what's causing it.
I talk to a lot of my patients and my parents about this. I said, look, if you're dealing with a behavior, you got to think about pain. And one of the biggest parts of pain that we don't remember if the child can't say anything is just teething. You know, they're teething or they're constipated.
Well, the babies are crying when they're teething. Yeah. That's not medical problem. You can see that one.
Yeah.
You can see that. But there's been kids that have non-speaking autistic people have died of appendicitis because they had no way of communicating.
And I hate when they go to the emergency room, you know, the families bring their kids to the emergency room and the kids often get ignored because the physicians just say you're on the spectrum, it's a behavior, be gone with you. And they don't get the assessment.
Well, they don't do the medical part of it. And this comes up all the time. It's completely terrible how that comes up all the time.
Yeah, I had two patients just this year. They brought their kids to the ER because they were screaming, and the ER kicked them out. But it turns out they were having a flare, one a flare from Crohn's disease, and another from ulcerative colitis, and we can ignore our kids.
Stomach issues are big number one. Gastrointestinal, big number one. I talked to one real low income family about 10 years ago, and I talked about this, and they said they went to the store and they bought some anti-acid medication, Prevacid, I think it was, and the kid is kind of spitting up stuff and having heartburn, and they gave him this medicine they bought in the drugstore, and it worked. And they also raised the head up to help keep the acid in the stomach, and those two simple things. She said it just saved their life. That and they treated the acid reflux.
Yeah, there's so much medical with these kids that gets ignored.
Oh, they're gastrointestinal. I've looked up the literature. There's tons of literature. And as an older person now, I'm getting acid reflux. I'm taking 2 Xanax a day, and if I bend over, I get it. You know, and then gets the valve in the stomach's not working right. I certainly don't want to have surgery on that. But now in my 70s, I've been getting this problem.
Yeah.
Yes, and it causes a lot of discomfort.
Yeah, especially in the morning. I talk to families, look, if your kid's screaming in the morning, we got to look at that acid reflux for sure.
Yeah, and if you can't, let's say you can't get medical help. I mean, I talked to a lot of people where there's just nothing. Try some other medication. You can just buy Zantac or Prevacid or something. Just try it.
Yeah.
Try getting the head of the bed up, see if it stops.
Yeah.
That's what you do if there are no services. Well, you get out in some of the rural areas, there's no services. In fact, they're closing down the rural hospitals.
That's horrible. I know it's
I
just
know it's horrible. I know it's
just for
horrible.
profit. You know, it's sad where our medical system is going. But
Oh no, I don't. Let's not get started on that.
that conversation would be another 5 hours if we
No,
went
let's
there.
not get started on that.
Let's
the other thing is
yeah,
making transition into the workforce,
good.
and that ideally, I want to start around little kids learning chores and doing the job outside the home. So we're getting a slow transition into work. Because I just a few months ago was at a college and heard about a very sad case where an autistic girl graduated from college magna cum laude and could not handle the workplace. She's a recluse in her bedroom. There was nothing done to teach life skills. I'm appalled at the 16-year-olds that don't know how to shop. They've never gone shopping. They've never ordered food by themselves in a restaurant, never had a bank account. I'm talking life skills here. And a lot of parents push way too much academics and not enough life skills. And I was terrible academically in high school, and I managed to catch up, but I was taught the life skills. In my boarding school, every week we'd go on a laundry expedition, and we'd go to the laundromat and wash our clothes. And then while the clothes were washing, we'd go buy stuff. And I'm looking back on it. I just looked at them as fun trips. But when I look back on it and what I'm seeing now, those trips every week into town were essential life skills training I was getting. We'd go to, it was at the Hampshire Country School. We go to Winchendon, Massachusetts, laundromat, and then you had a half an hour to do some shopping, some limited amounts of money we had, and then we also learned how to do laundry.
So let's do this. We're kind of coming up to our time for the end of the podcast. What if you were to and I want to talk to you more about Massachusetts. That's my neck of the woods. If you were to kind of tell parents about here's the best way to guide your child from age 3 to age 16, talking about life skills and how to encourage them depending on where the family's at, where would you guide them? Where's the map?
Well, the first thing is the early education. I already talked about that. If they have a 2 or 3-year-old kid's not talking, you've got to get them into a program. And if you don't have a program, maybe Massachusetts is better than some of the other places I'm thinking of in the U.S., you got to go to your church group, your neighborhood group, get some grannies to work with those kids. Because what I've found about teachers, they have to have the knack. They've either got it or they don't. And the knack is how to push just enough to get progress without causing a meltdown. It's the knack. And I've seen really, really good teachers do it. They just have the knack. And we can get into all kinds of arguments about whether it's ABA or this or that. I have noticed that good teachers, regardless of the name of the program, do the same things. Now, I think there's some ABA that got really rigid and bad. That's why the activists hate it. But the modern ABA is much more flexible. And then ABA type things were done with me as a very little child, but that was phased out by about age 6.
Yeah. So after that kind of early education, what's the best age to kind of introduce stuff at the home? When's the best age to introduce stuff out of the home? Like you mentioned, walking dogs, newspaper routes.
Well, then walking dogs, since that's independent outside, I'd say about 11 for that. But as a very young child, when I was 7, when I was 6, mother would take me to the grocery store. I'd help with shopping, go get things off the shelf. And I liked going shopping, and I didn't throw a fit in the store. And you go when the store's not so busy. I would definitely do that. But I was mother used to call it marketing. And I went marketing with her a whole lot. And I'm now looking back and realizing how important that was for life skill. And then when I was a little kid, when I was 8, I got 50 cents a week for allowance. That'd be about $5 now. I could buy 5 Superman comics. But if I wanted a 69-cent airplane, I had to save for 2 weeks. I was learning that at age 8. And there were certain items like comics and candy and airplanes that were considered allowance items. Same thing with kites. A kite and a string was 20 cents. but I'm realizing the important things that taught me. And that was standard 50s upbringing. And some people say I'm old fashioned. And then this gets into things, there's all the discussion now about masking. When do you have to conform? Well, I think you need to do some business social, shaking hands, saying please and thank you. And then the other thing, hygiene. You cannot be a rude, filthy, dirty slob, period. You can be eccentric. I saw a lady the other day on TV. She owned a bakery, and she had piercings all over her and red hair, and she looked kind of cool. But it looked, she looked neat. You can't be a rude, filthy, dirty slob. And when I had a boss that got after me about not wearing deodorant, well, back in the 70s, that was gooey stuff. I didn't stand the feeling of it. Now, these solid sticks, you don't even feel them. You just cannot be a rude, filthy, dirty slob. You can be eccentric. Now, I tend to just wear long pants and long sleeves for everything, for work clothes or dress clothes, because I like the fact it feels the same. Okay, so that's kind of an accommodation that I made. I can't say, I got to find pants that don't itch, for example. But you can be eccentric, that's fine. But when it comes to hygiene, you've got to clean it up. That's something that just has to be done. Well, even on a construction site, that will not be tolerated.
This is great. I mean, this is such great guidance for families and parents to kind of show them a road to how they can help their kids. And the theme that I'm hearing from everything that you're suggesting is it gives the child control. In a controlled situation.
Well, what I would do on the deodorants, they can try different ones. Well, and I would just go right for the unscented sticks. That's basically what I use. And then if I can't, they've run out of it, then I use the powder scented, but it's a solid stick. And you literally can't feel them once you've got them on. And so they recommend that. And then when it comes to clothing, you can get clothing at thrift stores. Like I buy pants at Walmart, and they're really good pants, but I have to wash them twice before they're wearable. And give the child some limited choices. Okay, there's different types of underwear. Like I wear these sports bras you just slip on that really soft. Because the other ones, I look at them and they're just itchy horrors. And you give some choice. Here are these soft sports bras made out of jersey that you slip over your head. They're so nice, I don't even have to learn to get used to them. And some choices. Here's some different pants at Walmart. Now I'm seeing the rack of pants at Walmart, and you can feel the different pants. And you can pick, there's like 3 kinds. You can let you pick one. You give limited choice. I'm not going to let them pick high-end $500 pants or something crazy like that. But you give them some limited choice. Here's the different kinds of underpants. And we got some choice there. And then we wash anything that goes against the skin. We wash maybe once, maybe twice. I find I still have to do that on the things that go against the skin.
This is fabulous. Again, choices with the clothing, or choices by giving the child headphones to put on when they want. They've got.
But I want to try to encourage not wearing them all the time. I want to explain to the child that if you wear those all the time, your sound sensitivity will get worse because your brain's trying to hear with the headphones on. It's sort of like when you have wax in your ears and you have the doctor take it out. Everything sounds loud. I'm sure everybody's had that experience. Well, that's because the brain's compensating for the wax. So you want to try not to wear them, but you have them with you. Okay, those horrible bathrooms with all that noise, you put it on for that. That's fine.
I love it. I love it. So one last question, and we'll wrap up. What do you want to make sure all parents out there know? They've got a child on the spectrum. They feel hopeless. They feel on an island. What do you want to tell them?
Well, when kids are very little, I looked very severe. You can't tell how a kid's going to come out that looks very severe. Now, if you have no epilepsy, that's usually a good sign. And then, and you don't have, look at the brain scan and go, my brain scan would have looked normal. You say you just don't know. You got to work on this kid really hard. You need to put that time in early. And then when I was a teenager, flunking out of school and everybody, nobody thought I could do anything. And then I had some very good mentors. Mother taught me to read when I didn't know how to read at age 8. I had my good third grade teacher who did the peer mediated intervention. Then I had Mr. Carlock, my science teacher, that got me motivated to study. And then a contractor, I'll show you some of my drawings. I learned how to sell my skills rather than myself. And he'd seen some of my drawings and he seeked me out to design facilities. And he helped me get my business started. This is mentoring. And I've had parents say, well, my kid got a job at a movie theater and he just blossomed. It's sort of like they get out and they start doing things. It's like the plant just starts growing really quickly. But they got to get out and do things. I'm seeing too many kids where they're not learning to do things. I want to caution against the rapid multitasking jobs. McDonald's takeout window, let's avoid that. Too much chaos. I can also think about in our bookstore, which would normally be a wonderful place for someone on the spectrum to work, not the Christmas wrapping station. That was a chaos. That just be chaos. So avoid that kind of stuff. The other thing that can be a problem is LED lights that flicker. And so if you're building a new school, let's get LED lights that don't flicker. And I don't have a problem with this. I would say maybe 10, 15% of people with autism have this problem. But when they have it, it's bad. Take your phone out, photograph that classroom in slow motion video. You'll find the LEDs that flicker. So what do you do if your school has that? Get the kid's desk over by the window. If you don't have windows, you buy a lamp and you find an LED that does not flicker. Let the kid pick it out, put it in that lamp, put it on the desk, and wear a hat. Hopefully, I know some schools prohibit hats, but that helps to block it out. I have a student that wears a baseball hat in our beautiful new building, which I just found out has lights that flicker in it. I teach a class now, I don't see it, but this is probably the single worst environmental thing in a building that you can have. And there's no way that we can change the lights in the ceiling if the classroom were stuck with them. But you can bring a lamp and you can bring in a small little LED light you could put on your desk. You see, I'm always trying to figure out something you could do. And you can buy cheap little LED lights that don't flicker. And they just work on a battery. Have it on the desk. Wear a hat. Okay, I'm always trying to figure out, and I see it. A simple thing that we can do. And then the other thing that helped me, I was taught to be on time when I was a child. See, problems with being on time, I never had that problem. That was drilled into me as a kid. We had a big old clock like this, old-fashioned clock, and I could watch the second hand go round. And when the second hand went round, the minute hand would go click. I could actually see it. It would do 5 clicks that you could see. And you can still buy these kind of clocks. They now work with little batteries, and they still do the click. And they're cheap. And I think that sometimes is better than a digital clock. And it's not expensive.
Well, this is wonderful, Temple. Thank you so much for your time. And I know the parents are going to love listening to you because you put yourself out there and you write books. And boy, my wife even has an old VCR tape of your work. We just
okay. I've been around for a while. I can remember when there was no VCRs or any of that stuff. You had to watch the show when they played it.
Exactly. You had to be there. So
you had to be there.
Thank you again. I really do appreciate your time and all the work, and I hope we can do this again sometime.
And I hope I've got some information out there. I like to just put out information that people can use.
That's what people need, and some hope.